This is a brief demonstration of the ADHD database software. These are the buttons that can be used to access the functions of the database. The first button opens an assistant based on the latest NICE guidelines. It talks about background diagnosis, comprehensive management, drug treatment, transition to adult services, and finally differential diagnosis and some information about comorbidities. You can view a flowchart from that button, and you can create a protocol here. You can select an existing patient here and then go and create a protocol. The protocol already contains some basic information obtained from the database, and you can add details of antenatal, neonatal, developmental history and other relevant information, as well as vital signs, weight, height, blood pressure and heart rate, and you can make some comments. And once you click generate protocol, it comes up with a page which can be zoomed, and you can print this out and put it in the patient's records. Now, coming out of that, and let's come out of here. The next button talks about follow-up checklist. This is just a reminder about the important information to be considered during follow-up of patients with ADHD. Close this form, and finally we close this form. The next button leads you to the database itself. These are records information about the patients. These are records of all the medications that has been prescribed for the patients previously, GP record, and any comment can add here. You can scroll forward and backwards, find records, or add a new patient, or you can delete a patient from the database. You can use this to select the date that is needed. Okay. Close form. Then this button leads to a small application that you can use to select a birth date, and then you can calculate the age of the patient. Close form. Finally, you have the administrator area, for which you require a password. In the administrator area, you can edit GP's names, add a new GP, edit their surgery addresses, add or delete names of prescribers. Let's check, for example, you can select any of the prescribers from the list and then edit and save the record. Okay, close this form. You can edit hospital consultants here, so you just add the names of the different hospital consultants, and that can be automatically taken access done on the database. So let's close that. And this facility gives you an opportunity to decide ahead of time how many patients require their prescriptions to be renewed over 1 day, 1 week, 1 month, or 1 year. Or you can manually select the dates yourself and then search, and this gives you a list of all the patients that require their prescriptions to be renewed within the time that is specified. You can print out this record and use it for planning purposes. So close this form, and finally close. So that is the end of the demonstration, and obviously this exit and closes the program. Thank you. I hope you enjoy it.